crisis is the number one cause of death in young adults, but usually we don't know the actual number of overdose deaths until months after the fact. Now, we need systems that can get this data out fast and at a local level so public health can definitely and fastly respond. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be discussing about an artificial intelligence tool that was designed to speed critical information on drug overdose deaths. According to a new UCLA research, an automated process based on computer algorithms that can actually read texts from medical examiners' death certificates can substantially speed up the data collection of overdose deaths, which in turn can ensure a more rapid public health response time than the system currently that is in use. Now, the analysis is published in the JAMA Network Open. It used tools from artificial intelligence to rapidly identify substances that caused this overdose deaths. So as it now stands, overdose data recording involves several steps, beginning with medical examiners and coroners who actually determine the cause of death and record the suspected drug overdoses on death certificates, including the drugs that were involved in causing the death. Now, these certificates are then sent to local jurisdictions or the CDC, which actually code them. Now, this coding process is very time consuming as it may be done manually also. So as a result, there is a substantial lag time between the date of death and the reporting of those deaths, which actually slows the release of the surveillance data. Now, this in turn actually slows the public health response. So for this study, the researchers used a natural language processing and a machine learning tool to analyze nearly 35,000 death records, and they found that around 8,700 overdose deaths recorded. The most common specific substances were fentanyl, alcohol, cocaine, methamphetamine, heroin, prescription opioids, and any benzodiazepines. So the researchers highlighted that if these algorithms were embedded within the medical examiner's offices, the time could be very much reduced to as early as toxicology testing is completed, which could be about 3 weeks after the death. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.